everyone. I'm Susi Keefe, Director of the Center for Justice and Law, CLOC, and we are excited to be hosting one of our Spotlight Conversations in our series where we talk about topics on health, justice, and the law with guests. I am really excited to be hosting our conversation today with Tsion Tulu, who is the fellow at the Center for Justice and Law this year. And we really wanted to spotlight conversation around our topic of immigrant and refugee health that allowed us to talk a little bit about why we're doing this topic this year and what inspires us around this topic. So thank you for joining us.
Thanks for having me. Quick intro. I'm the fellow for the Center for Justice and Law. I'm program coordinator. I'm also a Hamlin alum. Recently got my bachelor's in public health and global studies. Susie is my advisor, so she knows that. And yeah, I'm really excited for this year's programming and to be having this conversation.
So Tio knows that I asked to do this conversation today because I am excited to just have our community of Center for Justice and Law folks hear a little bit more about her background and why we were so inspired to continue working together after she graduated, and that this year's theme of immigrant and refugee health is really near and dear to her interests and experience, and that this was a great opportunity to sort of dive into that a little bit more. So let's go ahead and dive right into the conversation. Can you get us started with sort of why this is a topic that's near and dear to your heart and why you were really excited for us to expand our focus or shift our focus this year specifically to immigrant and refugee health?
Yeah. So I myself am an immigrant. I immigrated here when I was 6 years old with my older sister and my parents. My parents were here a while before me, setting up a life for us to come to. And so I can understand the immigrant experience to a point. Obviously, I was really young coming here, but I still got to see the transition of coming from a home and a world and a culture that was completely different from the American culture and following the American dream, as my parents had told me. So I had always identified with that, and I always kept my culture and my home and my ethnicity really close to my heart in all of the work that I did. As I said, I got my bachelor's in public health and also in global studies with concentration on sub-Saharan African studies. And that was really because I wanted to go into work that included Ethiopia and the things that are happening there, including conflict studies and all of these different aspects of the country as a whole. And so it was something that I always was interested in. And a lot of my work, even within public health, included immigrant issues and immigrant perspectives, which I felt, although a lot of institutions and organizations talk about the immigrant experience and talk about first generation students and how amazing it is to follow the American dream and all of these different things, the health of immigrants and the health and experience of immigrants wasn't really spoken to the way that I thought it should be, such as with mental health or navigating health systems or the language barrier and how big of a gap in access there is. And I also felt that, especially within Minnesota, the amount of, in my perspective, East African refugees and immigrants that are here, the large number that are present here and the organizations that are present and the community that's like continuously throwing events and doing all of this work here. And I still didn't really see that reflected in a lot of the programming that I was witness to. And so I wanted to bring that, my passion, my life, as well as my community to the forefront. And I'm really, really happy that I did, because as previous spotlights showed, the story of immigrants and refugees are so multifaceted, and no one's story is like the other, and yet it still has the same root, which is either inaccessibility or like fighting and struggling and still finding, hope in small places. And so, yeah, I hope that answers your question, but it was that was how I came upon this work, and I'm really happy that I did.
Yeah, that's great. We're getting into it here. One of the things I was really hoping we could hear a little bit more about today, because I think it's such an exceptional part of your time at Hamlin. So I'm hoping you'll tell us a little bit how you became involved with the student organization on campus, ISU, and some of the work you all did, because it's just, I think, really incredible, and I want people to know about it.
Yeah, thank you. Yeah, ISU, the Ethiopian and Eritrean Student Union at Hamlin is a small student organization that turned into one of the biggest and most precious experiences I've had at Hamlin. I was able to connect with amazing peers and do work that I still to this day cannot believe I was able to achieve. My first year at ISU, the board was able to organize a trip to Ethiopia and organize a conference there where we worked closely with health systems there and the YMCA, both the now I think it's called YMCA of the North and YMCA Ethiopia, and create comprehensive workshops around mental health, physical health, career development, and a bunch of different things, arts and media, and like all of this amazing workshops. And each of my peers on the board were able to lead those workshops. And I had the opportunity to lead a workshop on mental health and advocacy alongside Letty Mahali Tesfaye, or Letty. And I worked closely with a physician and psychiatrist there. And in a room full of, I don't know, like 30 to 40 adults who were much older than me, it felt a bit like I was kind of starstruck by the fact that we were able to bring this community together to talk about something as taboo, I guess, as mental health, and talking about it in an advocacy setting, talking about what it means for mental health, how does that translate, and creating transformational relationships between the YMCA Ethiopia and the people there with diaspora such as ourselves. And the work that we did there, I think will, like I said, I'll always hold it close to my heart, because that's something that I think few people are able to say, that they took the education and the passion that the institutions here gave us, and we were able to give it back and gain something from it from ourselves. And so, yeah, and ISU continues to do amazing work like that, including on-campus work, showcasing cultural events and all of these different things. And more recently, this was outside of ISU, but also in collaboration with me and a couple of young women who are interested in public health. Worked with a hospital, Zoditu Hospital, a labor and delivery ward, to create a grant for reproductive health. Unfortunately, last minute, one of our sponsors dropped out, so we couldn't submit the grant, but we worked closely with a health administrator there. We were able to see conditions of the labor and delivery ward. We were really motivated to change that in any way could, and that meant like creating a pilot program of like bridging the gap for getting like health-centered technology or advocacy or education and trainings. And so that all encompassed the work that I was able to do with ISU, and hope to continue to do so.
Okay, I have to ask, what was one of the things that really surprised you about the work you did with ISU and the workshops? I know it must have been incredible to return home and have that opportunity. And so was there anything that surprised you during your time there, like just observations?
Yeah, there was a lot that surprised me. First and foremost, it was just being back home and seeing the dramatic change that the setting that I had left came back to. I don't know if a lot of people know, but Chinese investors are in Ethiopia, and there was a lot of construction going on with the roads and buildings, and it just seemed completely different and constantly growing. And even outside of that, during the workshops itself, being able to co-create a curriculum alongside the YMCA people there and seeing what amazing work they were able to do with what little they had was absolutely amazing. One of the workshops we did was, or Mahalates did, was a dance workshop, which is something that I saw was something that was very near and dear to people's hearts there. They love the arts, and that's acting and singing and dancing. And the workshop that they did it in was a small house with no mirror, no plumbing, no lights really. And most of the time, the arts people, people were flooding out of the place because it was so small. And there was like at least 50 students and workers in this small, tiny place. And the kids had to walk God knows how long and dance on bare feet or flip-flops. And they still did it every day. They would come in and they were ready to work and ready to, do something that they loved. And at the very end, we had the opportunity to do a showcase for them on the Biharawi theater stage, where they were able to showcase their acting and singing and dancing. And it was amazing to watch that. But yeah, I think one thing that surprised me and still stays with me is the amount that people are able to do with the little that the government gives them, or the country is able to supply them. And I'm really, really proud of what little we could do, what little we could give, and hope that we can give more in the future.
Thank you for indulging me in that one. I definitely was curious what you would say, and I have so many more questions and thoughts too, just thinking about what I know you've done as a public health major and a global studies major, and then even the work that we do for the Center for Justice and Law, and our real commitment to centering community voices and community engagement. I just sort of see so many parallels of that and sort of the way you're describing your time there. So I'm curious, I'm going to ask a question and you can answer it however you want, but I remember a time where you and another student from ESU cooked an Ethiopian meal for students on campus. And I still remember you telling me that your moms were so thrilled that you were taking an interest in cooking.
Yeah.
and that you were cooking some of these Ethiopian dishes for the first time by yourself. And I thought that was such a kind of an amazing moment that your public health major sort of gave you that opportunity. And so it's making me, I'm imagining your mom sort of thinking about her journey and then seeing you return to Ethiopia to do this beautiful work. Yeah. And to support your family and your community in that way. And so what has it meant for your family that you were able to return and do that work?
I mean, I don't think I've seen them as happy as when I told them that we were going back to do these workshops, and as happy as when I'm able to represent our culture in a holistic way. I think that hosting that event with the Ethiopian foods and talking about how Ethiopian nutrition and nutrition of ethnic foods is actually much higher than people see it as, and being able to educate about my own culture and the culture of like a lot of different immigrant people in that way is something I'm always proud of. But my parents especially, to see that they had left a home, or their home, their family, everything they knew for 22 plus years, and not going back for a really, really long time, and being able to see us showcase that and then go back. And I was able, on my trip with ISU, I was also able to visit my grandmother who I hadn't seen in a really long time, and I might get emotional thinking about it. But yeah, I remember my mom hugging me as she was dropping me off at the airport and saying that she was really proud that, we were able to do something like that. So I think it means a lot to them because one way or another, even if the American dream doesn't work out for a lot of people that come here, and will probably not work out for a number of reasons of access, being able to have moments of hope like this and silver lining like this and having opportunities like this is definitely amazing. So yeah, I hope that answered the question.
I think so, definitely. I often think about you sharing that story about your mom, calling your mom and asking about the recipe, and that just I can relate to that. So that was, I was expecting that it would make her happy that you were able to return and do this work and really connect your intellectual and advocacy sort of lens in your home. So that is I think really great. Okay, so we can maybe think of some other things to talk about. So this year for the Center for Justice and Law, all of our programming is centering on immigrant and refugee health. And so we've had lots of conversations about why we wanted to do that and what that means for our team and what it means for our community. And I'm just wondering if you want to just give us a little insight into sort of what pursuing this topic means for you. What are some of your goals, and what do you want people to know? You've sort of shared a little bit about that you don't always see enough of what you're looking for in the places that you often encounter. And so what's some of your vision?
Yeah, so I think when we first started creating programming and even thinking of this theme for this year, it was during the midst of the pandemic, and there was a lot of talk about how COVID had shown all of these gaps in access and health and all of these things, and how vulnerable communities, BIPOC communities, were victim to it most of the time. And I was really able to see that through my mother, who was a nursing assistant and had contracted COVID, and through family who, like throughout the time, who were vaccine hesitant because of different reasons, and also working at Alina Health for a while and seeing how vaccine advocacy and how COVID-19 and their connection to the immigrant population was, and all of these different aspects really helped me think about why it was so important to have this community at the forefront of the theme for this year. And I'm kind of blanking, but I I think, oh yeah, when I was first thinking of the theme for this year, my mind had gone into, we have to talk about COVID and the impact of it on immigrants and refugees. Like that, that's something that I have yet to see. I don't know, maybe I'm looking in the wrong places, but I haven't really seen how COVID has impacted immigrant communities in Minnesota, in the US, and how the language barrier, especially, is such a huge creator of gaps. And so one of the visions for this year was to talk about the issues that impact the community as a whole, but the issues that aren't spotlighted the way that it should be. And I think skin lightening is one of those things. Skin lightening is something that's very common in immigrant communities all around, in East Asia, South Asia, Africa. All of these different communities go through it, and it has a lot of health impacts and mental health impacts that we don't really talk about. And to create a space where we can convene with people of different backgrounds and different experiences and different expertise and talk about it in a way that still centers community is something that I'm really proud that we can do, proud of. And yeah, I think continuing down that road and talking about these different issues is really, really important for moving forward, moving like immigrant health and refugee conversations forward.
Yeah, I'm really looking forward to that event. It's going to be, I think, exceptional to hear from so many folks who are um, engaged in it. And I think especially to be getting into sort of the global context of it too. We have so much happening in Minnesota to really spotlight, but I think that putting us into a global conversation will be a really important piece of it.
Yes.
So we are so concentrated on our December 3rd event that we haven't spoken a ton about our spring programming, but since you mentioned COVID and sort of our some of the other things we're thinking about, what are some of the, I feel like I'm now sort of publicly asking you if I make one of our meetings here. But yeah, I mean, you know, so now that you've been in this position with the CJL as a leader, what are, you know, we're now 3 or 4 months really into it. How is maybe some of your thinking about spring programming shifted or become more specific, and what are some of the things you're hoping for us to tackle in the spring?
Yeah, so I think staying with the structure the past year and for our most of our events, which includes having a community-oriented panel of advocates and people who have justice impacted folks, and having them lead the conversation in their own expertise is something that I hope to continue to do. And I know with your leadership and, you know, the student coordinators as well, I know that that will be the path that we continue on. And tackling the topics, I feel like this coming event is like a really great example of it, because we have so many different kinds of experts and different kinds of experiences. And I hope to continue down that road as well for our future events. And that can be, you know, having a panel on vaccine hesitancy and also a global perspective of what vaccine distribution looks like to the global south, and how the inaccessibility of it is really one of the reasons for it, as well as like a history of what vaccine and medical trauma for the BIPOC community and how that, you know, goes forward for COVID and all of those things. As well as I'm also really interested in, I know last year we did incarceration and we ended on reproductive health. And I think reproductive health within immigrant refugee populations is also something that we could perhaps tackle, and getting you know, birth giving people on the board and like talking about what it looks like, and that can be as big as FGM to taboo sex talks and things like that. And so far too, I feel like the big theme of navigating health systems is also something that we could talk about. I feel like I'm just going on a tangent of all these great things that I want to see done.
We need 5 years. We need 5 years.
There's just so much. Yeah. But yeah, I feel like having a panel on different aspects of that would be, I think, ideal.
Some of our spotlight debriefs that we've done as a team, one of the observations that we've made quite often is how often our guests highlight mental health as a topic that impacts them, that is misunderstood, that they care about. And it wasn't really on our radar as a topic for this spring. And we haven't actually talked about that it should be, but even today, you've mentioned it a number of times, and I just keep coming back to that. And I think it probably interconnects with a lot of the topics you've brought up as well. But we have, I think, a very long list of topics. We're going to have to figure out how we can fit 5 years into 6 months.
Yeah.
So I guess with the remaining few minutes that we have, I'll ask maybe one last question. So if you could leave this conversation with one anecdote or message about our topic, what would it be? What do you want people to know about immigrant, migrant, refugee health?
I think Uba and Ruben and a lot of our previous spotlight guests have said it perfectly when they said to listen. Listen to immigrant and refugee stories, listen to their perspectives and experiences, and then take action afterwards. And that means educating yourselves. There are so many resources out there that talk about immigrant and refugee health and wellness and all of these different things. And that includes, especially in Minnesota, there's so many resources that we don't know about. And so do what you can afterwards. If that means creating a fundraiser for things that are happening abroad, or educating yourselves and your peers in your classes about things that are happening, or listening to your immigrant and refugee friends and helping them navigate resources that you may have access to, and using your privilege and to give them access to things that they might not have access to. And so I feel like that's a message that I think should resonate with a lot of the topics that we talk about, is to listen, to give access when you can, and to educate yourself and folks around you when you can, and take action. Yeah.
Okay, do you have anything else that we didn't get to that you really wanted to share or talk about, or that I didn't get to?
Not really. I did have a recent experience that really showed, I don't know, it just made me very thankful that we were doing this theme this year, because it was like itching at me. I was at a test center for COVID about a couple of weeks ago, and I was sitting in the waiting room when a Spanish speaking family came in, and the language barrier was like, they were unable to even make an appointment or talk with the people at the front desk. And it was heart-wrenching to watch. And I wished that I knew something or could do something to help them. And that's something that happens every day, is, a language barrier or some kind of obstacle in the face of health systems that causes somebody to not get a test, or somebody to not get medication they're supposed to get. And there's just like the larger healthcare infrastructure as well. But I don't know, that was something that's always been nagging at me. And yeah, I wanted to kind of get that off my chest as well. Like, that's something that continues to happen every day at local clinics. And, so yeah, that refugee and immigrant experience can look like a lot of things, but it can also look like that. So.
Well, thank you for sharing that. I think it's a really good illustration for how things that we take for granted, health literacy, language access, even for something as simple as COVID testing, right? That we need to really continue to think about inclusion and equity and accessibility, and the role that has in belonging. And that takes us right back to mental health, and it's all connected.
Yeah.
So yeah, thank you for sharing that. I am so glad we had a chance to have this conversation today. And I knew that we would just scratch the surface of all the things we could probably have a spotlight, just you and me every week, and we could keep chatting. But we will wrap this one up and say thank you to everyone for joining us, and hope Tsion's experiences and insights will inspire you to take action and continue to connect with us. Be sure to follow us on our Instagram and Facebook pages, where we have lots of excellent, exciting information that we're sharing regularly. Our next spotlight will be next Wednesday, November 17th. And please check out our upcoming event on December 3rd, which will be focusing on global and local context of skin lightening and colorism. And thank you so much for tuning in today.
Thanks for having me.